Well, hello, everybody, and welcome back to our second season of our podcast here. We call this podcast Start or Sit. In this podcast, Dr. Hawkins and myself, Shannon O'Kelley here, we're going to talk about previous injuries in the NFL. Particularly to those folks that maybe might be on your fantasy football team. And so you fantasy football players out there, this podcast is going to tell you whether or not that player is going to start this week or is going to be out or sit, and how long is that player going to sit? What is the injury? What is the rehab process? So you can create some expectations and place your players in the previous or the coming up week roster. Dr. Hawkins, how are you?
I'm doing wonderful this morning, Shannon. Thanks again for having us back for year two.
Season two. We're gonna keep it in the season two. We're not on the IR. We're back at it. We're starting this podcast. We are starters. You and I are starters here, so that's exciting. Tell our listeners, just to refresh, maybe some listeners that listened to us last season, but maybe our new listeners. Man, you have a really, really interesting background. You're an orthopedic surgeon specializing in sports medicine. You treat these injuries. Your expertise is vast. Tell our listeners maybe a little background of Dr. Hawkins here.
Yeah, absolutely. So I work in Washington Orthopaedics, and we basically see all different athletes across the spectrum. I've been doing this about, I guess I'm on 21 years now in private practice, and I've kind of taken care of everything from NFL players down to, middle school, basketball athletes. And, the focus for my whole career has been essentially on how do we get these people back? How do we get them functioning at the level that they can perform? And again, that can be from, a Saquon Barkley, down to, my youngest daughter's friends on the basketball team. So that's really the focus of where we are. And hopefully I can give some insight into these injuries and help everybody understand why they're coming back quick or why they're taking a long time and predict that for you.
Awesome. And your interest and your focus in your orthopedic practice, I mean, it's fair to say that you're a sports medicine specialist. Is that fair to say?
Yeah, exactly. I went through the typical training an orthopedic surgeon does with some additional time specifically doing sports medicine. A lot of that from a surgical perspective ends up being a lot of upper extremity injuries, things like shoulder and elbow injuries, lower extremity injuries when you talk about people with ACLs, and then ankle injuries. And so all of these things we run into across that spectrum of sports.
Yeah, and so here we go. We're going to start this podcast again. This is Start or Sit. We're going to talk about previous injuries and then in the NFL, and we're going to talk about this player or that particular player, what that player is going to go through to get back to start, or how long are they going to sit or be out of the game. And we have a big one here starting right off the bat. I'm going to give you a big one here. This was a significant injury. This is Trey Lance, starting quarterback, San Francisco 49ers, took the place of Jimmy Garoppolo, and he was starting. He looked good. He's a mobile quarterback. He went to run. Man, on TV, you could see exactly what happened. He had an ankle injury. That's a significant injury, though. Talk about Trey Lance, Dr. Hawkins.
Yeah, so a lot of people, when they saw that video, if you kind of coned in on it, everybody first started thinking this looks almost like Dak Prescott. That ankle was not facing the correct direction. Luckily, it appears he did not have quite as severe of an injury. So what he did is there's two bones in your lower leg. The main weight-bearing bone is the tibia. There's a small bone on the outside of your ankle called the fibula. So what ended up happening is he broke the fibula, and then the reason his foot turned that way was a combination of the break, but also damaging the ligaments that help to hold those two bones together. What he didn't do is he didn't actually break the inside half of the tibia, the medial side of the ankle. And so that's where long-term his recovery actually looks a little bit better. So he underwent surgery, and they essentially put a plate and screws on to put the fibula back in line. That's the outside part of the ankle. And then they put essentially a suture or a tether between those two bones on the inside to allow that ligament that holds those two bones together. And that's why they're saying, hey, he's probably done for the season, because of the time to allow for that ligament to heal. And you mentioned it perfectly, Shannon. He's a mobile quarterback. So that's going to factor into their decision-making process. I think if he was not perhaps in that position, perhaps he was somebody that was, a lineman, that may be something he'd come back at about 12 weeks, but that's so close to the end of the season and his conditioning won't be great. So I think he's probably going to be gone for the season as they projected. You always think maybe something will pop up at the end, but he's definitely not playing this weekend.
Yeah, I mean, I've heard he's out for the season. Now, you described that injury perfectly. Would you call that, I mean, when I saw it, I would assume, based on the fact that they brought a splint out or an air cast or an air splint immediately, put him in a splint, got him on the cart. What I looked at, would you call that a fracture dislocation? So you're fracturing a bone, but you're also dislocating the joint, which you described disrupting soft tissue, connective tissue, and particularly those ligaments that are very important. So that's a fracture dislocation. Is that right?
Yeah, exactly. And that's the basic thing where that foot's turned sideways. That usually means that the joint's no longer aligned, and that's how the dislocation comes into play. Yeah,
a significant injury. I mean, I feel bad for Trey. He had a pretty good start. He was looking really good against our Seahawks, by the way. But here we go. We've got 3 rib injuries here, significant players here. We've got Justin Herbert, Alvin Kamara, and Jeudy. So they all have rib injuries. Man, that's a painful injury. I've done that to myself. And that takes time, doesn't it? Tell us about these rib injuries.
Yeah, so the good thing about rib injuries is generally, obviously, they don't need surgery. Sometimes in major trauma situations, they will actually put plates and screws on them if there's like a lung collapse. But in athletes, like you mentioned, Shannon, it's a pain issue because anytime you take a deep breath and you have to expand your chest, it's putting pressure against that area. So when you look at these 3 players, I think what you have to look at is what position they play. Okay. So for Justin Herbert, we've always seen quarterbacks out there wearing the extra paddings, what they call like a flak jacket around their midsection. So generally, if they take a big hit and somebody lands on them on the ground, they're going to be miserable. But other than that, they can generally move and throw. So I think Justin Herbert will be a play this week. Judy, wide receiver, again, it may compromise a little bit of his endurance or his speed if he's not breathing really well. But generally, he's not a guy who takes a lot of hits across the slot. He's trying to run in open space. So I think he's a play. I think the biggest concern is potentially Alvin Kamara because you've got a between the tackles runner who relies a lot on contact in the line and slipping around people. So I think he'll play, but if he's on your fantasy thing, I'd be careful. If you've got a backup that's a little better than him, I might start him ahead of Kamara just because of that and the position he plays. But I think all of them will play this week.
Yeah, and these injuries, this is biology. I mean, this just takes time. But you described it and mentioned, people need to understand when these athletes are out running around, that rib cage is very active. It's going up and down, and that can be really painful. And if you get hit there again, boy, that's exceedingly painful. So let's just review this. You got Justin Herbert as a play. That guy is on fire for the San Diego Chargers. He's a play. Alvin Kamara, you got him as a play. And Jeudy, you got him as a play. All 3 should play this week 3. Is that what you're saying?
Yep, I think they'll all play. And like I said, just productivity might be a question for Kamara.
Okay, good stuff. Hey, talk about an unfortunate player. Boy, this guy, Dak Prescott, I mean, you described it earlier. You said last season or a couple seasons ago, he had the similar injury that Trey Lance just experienced, a fracture dislocation of his ankle. I believe he was out the remainder of the season, lost a lot of time that season, comes back, and all of a sudden he has some kind of thumb injury. I just know that he's got a thumb injury, and they just described him having surgery. What's going on there?
Yeah, so they've been actually a little, cloaked about their specific information here. So some of what I'm going to say is based upon the timeline. So we know it's an extra-articular fracture, meaning the fracture didn't go into the joint. So it didn't go into probably the top or the bottom of the bone itself that was broken in his thumb. And the fact that they're talking about him already being able to grip a football and potentially playing in another 1 to 2 weeks because they did not put him on an injured reserve, that probably means he was either a fracture of his metacarpal or his proximal phalanx in his thumb. So those are the two long base bones in your thumb. And they were probably able to put on a plate and screws which stay in so they don't have to take pins out. And because it doesn't go in the joint, they can start moving it right away. So he will not play this week. I think the expectation is they'll see if he can grip a ball and throw a ball next week. And because they didn't put him on IR, there's a chance, especially depending upon how much they're struggling with his backup, he may be back for week 4, but he's definitely a not play for week 3.
He's out for week 3. Did you say he had surgery? He had a plate put in there with some very small screws and a plate, and that metal will stay in through the season as that bone heals in. So it's essentially a shaft fracture of that thumb digit.
Yeah, I think we have to assume that's what it is.
Yeah.
There's a small chance perhaps it was a piece that was able to be fixed just with screws. But again, that timeline means that it wasn't in the joint and that it's like you said, in the shaft or the mid portion of the bone most likely.
Yeah, for you listeners out there, I think you all can appreciate how important the thumb is. I mean, I believe the thumb is the most important finger you have. I mean, you do everything with your thumb, and gripping a ball is very important with your thumb. So he's out week 3. Possibly returning week 4 based on what we know. Keep an eye on him, though. I want to talk about George Kittle, San Francisco 49ers. He's got this groin injury, and these things can linger and be problematic. When is he coming back?
Well, the good thing here, all indications is that they were being very cautious with him because it was the beginning of the season. Mm-hmm. He did not seem to have like a major contact injury. It sounds like it was just a motion injury when he was practicing. And so it's probably a soft tissue strain. And I think that they were just being overly aggressive and resting him the first 2 weeks. I'm pretty sure he's going to play this week. And it doesn't seem like it's that sort of traumatic thing where he got tackled, got pushed into like a splits and actually ruptured a groin muscle that will require anything long term. So for those of you who obviously there may not be a lot who listen to us who are 49ers fans, given the strong Seahawks contingent we have. But unfortunately, I think he will be back, and I think he will be productive this week.
Oh boy, that guy's a producer. I mean, when he comes back, they could be really good. They looked good on week 2, that's for sure. Hey, these groin muscles, we hear about these muscles, but let's talk about the biology and the mechanics of this muscle, because as an athlete, i.e. a tight end, wide receiver, running back, these lateral cuts and the things you have to do in motion, these groin muscles are susceptible to being torn. But it's a biology thing. Again, it takes about 8 weeks for those muscles to completely heal. What is his susceptibility when he goes back on the field if that thing is not completely healed and he re-injures it or re-aggravates it?
Yeah, we've definitely seen it in the past. I think we had a couple players last year who literally sat every week wondering whether they were going to come back. And the issue is obviously those muscles are crossing your hip joint. So they're trying to stabilize your lower leg to your pelvis. So it's kind of like the leg on a chair. If that leg is really wobbly, when you sit on the chair, you're going to tilt off to one side or the other. So it's all about balance across that area. So you've got sort of groin muscles. Typically, that's going to be what's called your adductors on the inside part. And then that's compared to sort of like the ones in the front that flex the hip. And then in the back, you've got your hamstrings that work on extension. So again, you've got sort of like a 3-legged stool, but one of those legs is potentially weaker or more wobbly. So you brought it up perfectly, Shannon. The concern is if you see him make a hard cut in the beginning of the game and come out, that's not going to be a good sign. But like I said, I think based on the timing and how he first hurt himself, I think they were being overly cautious. They'd probably been really working on strengthening and balance work these first 2 weeks, and knowing that if they put him out that week 1, then they were worried it would turn into that lingering issue.
Yeah, these groin injuries, like you said, you used the word lingering. We've all seen these athletes get injured in preseason, and they try to return, and they just keep re-aggravating that muscle. Particularly a groin strain, it just takes time, but they have to be well healed to get that athlete back. So you're thinking he's back this week, George Kittle? Coming back?
Yes. Yeah, I think he'll be playing this week.
I bet there's some excited fantasy football players out there to get George Kittle back. That guy's a producer. He catches everything that's thrown at him. Speaking of catching, this guy is coming back early, it looks like. Michael Gallup, Dallas Cowboys wide receiver, tore his ACL last season. It's about 7 months ago. They're talking about him coming back. That's pretty quick. That's good for him. That's quick, though.
Yeah, it's interesting how the pendulum swings with different players. And, you've got somebody like a running back, JK Dobbins, who plays for the Baltimore Ravens. He is a calendar year out now from his ACL surgery. So he had ACL surgery in September. It's now September of 2022, and he's not back playing. On the reverse side, Gallup tore his ACL first week in January. They waited a month to do his surgery because of swelling, so he had it in the beginning of February. So now we're talking only 7 months or so out, and he's potentially coming back. So that usually points to two things. One is obviously the techniques of placing these things and the fixation have gotten very, very strong. We do know the biology is usually pretty good around 6 months. The question of why you come back between 6 and 12 months is usually conditioning and strength in other areas. And so some of these athletes are just so amazing, like they seem to hit all of those metrics.
Yeah.
My only concern, Shannon, with Michael is even when you hit all those metrics perfectly, statistics will tell you that your re-injury rate in that first 12 months, if you come back to a sport after an ACL, it's always higher. So obviously they're probably having discussions with him, but he's met everything that they want. He probably understands his risks are a little higher, and I think he's going to go. And I think some of that's driven by their need to, try to win games with Prescott out for a little while.
Yeah, so I mean, he's on his way back. So if you have him on your fantasy football team, are you potentially starting him? Is he gonna play week 3, or are you gonna wait until week 4? What would you suggest?
Yeah, I would not play him this week. I think they'll probably test him out on some routes.
Yeah.
I would sit him this week, but I think he will actually play in the game. And I think, obviously people are very smart with their fantasy teams nowadays, but if you're in a league that's relatively new and somebody forgot about him because he'd been on, injured reserve, and he's on the waiver wire, I would pick him up this week because his numbers won't be great. It'll be another week till they get good, and you might sneak him on your team.
Well, there you go. Good stuff. Dr. Hawkins, once again, fantastic job. I mean, I enjoy this so much. So excited. I'm excited for our season 2. For you folks out there, tell your friends about our Start or Sit podcast. If you're actively playing fantasy football, this is a great opportunity to get the lowdowns, basically, so to speak, return, start, sit, play from Dr. Hawkins and myself. We're glad you joined us, and we look forward to talking and speaking next week. Thank you.
Yep. Thanks again, Shannon.